drug monograph for salicylic acid, suitable for nursing, pharmacy, or medical studies. It includes every section in full clinical depth and clear formatting for notes or a report. Salicylic acid detailed drug monograph. 1. Basic drug information or name, salicylic acid, drug class, pharmacologic class, keratolytic agent, beta-hydroxy acid, BHA, therapeutic class, anti-acne agent, dermatologic agent, topical keratolytic, brand names, examples, topical, compound W, duofilm, Dr. Scholl's, Clearasil, Neutrogena acne wash, Oxy, Stridex, clean and clear, Propa pH, shampoo formulations, Ionel Cebulex, available dosage forms, topical solution, liquid 0.5% to 40%, creams and gels 0.5 to 6%, lotions 1 to 6%, pads or wipes 0.5 to 2%, ointment 3 to 6%, shampoo 1% to 3%. 2. Definition: salicylic acid is an organic acid derived from salicin, found in willow bark. It acts as a topical keratolytic, comedolatic, and desmolytic agent, helping to remove the outer layer of the skin and unclog pores. It is used in dermatologic therapy for acne, psoriasis, warts, corns, calluses, and dandruff. 3. Mechanism of action: keratolytic action. Salicylic acid solubilizes intercellular cement in the stratum corneum by breaking down desmosomes between epithelial cells, leading to softening and shedding of the stratum corneum. Comedolatic effect: it penetrates follicles, removes keratin plugs, and clears blocked pores, preventing new comedones, blackheads, whiteheads. Anti-inflammatory action: being a salicylate derivative, it mildly inhibits cyclooxygenase, COX enzymes, reducing prostaglandin synthesis, and thus inflammation. Antimicrobial and antifungal activity: at higher concentrations, it exerts bacteriostatic and fungistatic effects by acidifying the skin surface and inhibiting microbial growth. 4. Pharmacokinetics, parameter detail. Absorption: minimal through intact skin, enhanced with damaged skin, occlusion, or prolonged use. Distribution: once absorbed, distributed in most body tissues, crosses placenta and may enter breast milk. Metabolism: hepatically metabolized to salicylate and its conjugates, salicylic acid, glucuronides. Excretion: primarily renal, excreted as free salicylate and metabolites. Half-life, dose-dependent, 2 to 12 hours, longer with high doses or renal impairment. Toxic threshold: plasma salicylate 30 milligrams per deciliter indicates potential toxicity. 5. Therapeutic uses: acne vulgaris, mild to moderate, seborrheic dermatitis, psoriasis, plaque, scalp, ichthyosis and keratosis pilaris, dandruff, warts, common, corns and calluses, exfoliation of hyperkeratotic lesions. 6. Indications: topical acne therapy, 0.5 to 2% concentration, keratolytic therapy for psoriasis, ichthyosis, 3 to 6%, removal of warts, corns, calluses, 17 to 40%, plaster or liquid. Scalp disorders, shampoos 1-3%. 7. Contraindications: hypersensitivity to salicylic acid, salicylates, or aspirin. Use on infected, broken, or inflamed skin. Children under 2 years old, risk of systemic absorption and salicylism. Diabetes mellitus or peripheral vascular disease, risk of poor healing, especially with wart corn removers. Extensive or prolonged application over large body surface areas. 8. Precautions before taking: avoid contact with eyes, mucous membranes, genitals, or open wounds. Avoid using with other topical irritants, retinoids, benzoyl peroxide, alcohol, sulfur. Do not use under occlusive dressings unless directed, increases absorption. Caution in pregnant or lactating women. Small topical use is considered low risk. Caution in hepatic or renal impairment due to risk of salicylate accumulation. Children and elderly are more susceptible to systemic toxicity. 9. How to use for acne: 0.52%. 1. Clean and dry affected area. 2. Apply thin film 1 to 2 times daily. 3. Start once daily to assess tolerance, then increase to twice daily if needed. 4. Avoid overuse. Excessive dryness or peeling may occur. For warts, corns, calluses, 17 to 40%. 1. Soak area in warm water for 5 minutes. 2. Dry completely. 3. Apply medication directly to wart callus. Avoid healthy skin. 4. Cover with occlusive dressing if directed. 5. Remove softened tissue gently with pumice stone after several days. For scalp, 1 to 3% shampoo. Apply to wet hair, lather, leave for 3 to 5 minutes, rinse thoroughly. Use 2 to 3 times weekly. 10. Dosing information: indication, concentration, frequency, duration. Acne, 0.5 to 2%, 1 to 2 cups daily. Continue as tolerated. Psoriasis, 3 to 6%, 1 to 2 times daily as needed. Warts, 17 to 40%, once daily until resolution 6 to 12 weeks. Dandruff, 1 to 3%, shampoo, 2 to 3 times weekly maintenance as needed. 11. Misdose and overdose. Misdose, apply when remembered, skip if next dose is near. Do not double apply. Overdose toxicity. Systemic absorption may cause salicylism, especially with large area or prolonged use. Symptoms: tinnitus, dizziness, confusion, headache, nausea, vomiting, hyperventilation, metabolic acidosis. Treatment: stop drug immediately. Provide supportive care, alkaline diuresis, activated charcoal if ingestion, and monitor serum salicylate levels. When to stop or avoid continuing: severe skin irritation, redness, swelling, or burning, rash, blistering, or excessive peeling, signs of systemic toxicity, tinnitus, nausea, dizziness, lack of improvement after 6 to 8 weeks of therapy, onset of allergic reaction or sensitivity. 13. Side effects: common, rare, serious, mild burning or stinging, severe irritation or allergic dermatitis, dryness or peeling, tinnitus, dizziness, systemic absorption, temporary redness, salicylate toxicity if overused, thinning or scaling, skin whitening or swelling or blistering of skin. Vital key information. For external use only. Avoid using with strong exfoliants or alcohol-based products. Do not use on large or multiple areas simultaneously. Keep away from heat, open flame, and eyes. Some solutions are flammable. Wash hands thoroughly after use. If symptoms worsen or persist, seek medical advice. Storage: room temperature, 15 to 30 degrees, tightly closed container. Patient education point: continue gentle skincare, sunscreen during the day. Salicylic acid increases sun sensitivity. 15. Drug interactions. Although topical absorption is low, systemic interactions may occur if absorption increases. Interacting drug effect: other topical irritants, retinoids, benzoyl peroxide, increased irritation, dryness, aspirin or other salicylates, additive systemic toxicity. Methotrexate, increased serum methotrexate levels, toxicity risk. Oral anticoagulants, warfarin. Potential enhanced bleeding risk with high systemic absorption. Topical corticosteroids, reduced efficacy due to barrier removal. Alcohol-based cleansers, increased irritation or dryness. Thank you. Have a nice day.